Hey guys, welcome back to Insurance Explained USA. So, let me ask you something. Did you know that a family in Texas ended up paying over $20,000 last year just because they chose the wrong type of insurance? Yeah. That's a real story. And the craziest part? They could have paid less than half if they picked the right plan. That's why in today's video, we're diving into one of the most important questions anyone living in the US has to ask. Should you go with Obamacare or private insurance in 2025? Let's break it all down, no jargon, no confusing terms. Just clear, honest info. What is Obamacare? Alright, let's start with the basics. Obamacare, also known as the Affordable Care Act or just ACA, is a government program that helps people get health insurance at a lower cost. It's designed mainly for people who are low to middle income. Here's the good part: if you qualify, the government helps pay your monthly premium. That means you don't have to cover the full price by yourself. Like, if you make around $30,000 a year, you might only pay $0 to $50 per month for insurance. And even families making $70 to $80K can still get support. Plus, no matter what your health situation is, they can't deny you. Pre-existing condition? Covered. And every plan under Obamacare includes important stuff like ER visits, prescriptions, mental health care, maternity care, and more. You can sign up at healthcare.gov or on your state's website if they have one. What about private insurance? Now let's talk about private insurance. This is insurance you buy directly from a company, not through the government. So, you don't get financial help based on your income. You pay the full price. And yeah, that full price? It can range anywhere from $300 to $800 per month, depending on where you live, how old you are, and what plan you choose. So why would anyone choose private insurance? One word: flexibility. With many private plans, especially PPOs, you don't need referrals. You can go straight to the doctor or specialist you want. You can even go out of network if you really need to. And the best part? You can sign up anytime. No need to wait for open enrollment. That's huge if you just moved, changed jobs, or forgot to apply for Obamacare. Which one is cheaper? So, let's be real, which one saves you more money? If you qualify for subsidies through Obamacare, it's way cheaper. Like, thousands of dollars cheaper. But if you make too much to qualify, you'll have to pay full price. In that case, private might make more sense, especially if you want specific doctors or better access. Doctor networks. Here's something most people forget to ask: can I keep my doctor? Obamacare plans are usually HMO or EPO, which means you can only see doctors inside their network. If you go outside that network, sorry, you're probably paying 100% out of pocket. Private insurance often gives you PPO options, which are way more flexible. You can choose your doctor, see specialists without referrals, and even go out of network if you really need to. So if you have chronic conditions, see a lot of specialists, or just want more control, private might be better for you. When can you sign up? With Obamacare, you can only sign up during open enrollment, which usually runs from November to January each year. Miss that window? You'll need a qualifying life event like losing your job, getting married, or having a baby. But with private insurance, you can apply anytime. No waiting, no stress. Safety and transparency. Another big point: how safe is your plan? Obamacare plans are highly regulated. They have to cover specific things. They can't leave out important services. And they can't deny you for having health issues. Private plans? Not always. Some are great. But others might leave out key services, or limit coverage for pre-existing conditions, especially if you buy outside the marketplace. So always read the fine print. So, which one is right for you? Here's the part that really matters. If you're new to the US, have a moderate or low income, or you just want something safe, predictable, and affordable, Obamacare is probably your best choice. But if you earn more, want total control over your doctors, or need a PPO plan, private insurance might be worth the higher cost. It really depends on your health needs, your budget, and how much flexibility you want. What's changing in 2025? Quick update for this year. In 2025, Obamacare subsidies are still expanded, so more people than ever qualify for discounts. Some states are even adding new Medicaid options. Meanwhile, private companies are stepping up too. More telehealth, more mental health benefits, and lower-cost prescriptions are becoming standard. That's why this year, it's more important than ever to compare carefully before you decide. Mistakes to avoid. Real quick, here are the biggest mistakes people make. Thinking Obamacare is just for poor people, it's not. Choosing a private plan without reading the fine print. Not checking which doctors are in network. Missing enrollment deadlines and getting stuck without coverage. Don't fall into those traps. So, what's the final answer? There isn't one. There's no best plan for everyone. Only the plan that fits you, your needs, and your situation. Still not sure what to choose? Drop your question in the comments, and I'll personally reply and help you figure it out. If you found this helpful, don't forget to like this video and subscribe to the channel. Insurance Explained USA. This is the place where we make health insurance simple for real people like you. Thanks for watching, and I'll see you in the next one.